spread of COVID-19 is a big concern as thousands of students head back to the UW campus.
One of the nation's leading experts, Dr. Deborah Birx, has suggested something called surge testing. What does that mean? Dr. Zorba Paster joins us now from his office in Oregon, as he does every Thursday. Zorba, good to see you.
Hi, Zorba.
You guys, good to see you guys.
Surge testing, what are we talking about?
Well, the whole issue is, how do we get a whole group of people tested all at one time to find out where the prevalence of COVID is? And then how do we continue to test them after that? And so the idea is that you have periodic times where you're actually testing people, see where it is on campus, so you can make intelligent decisions. And that's the whole issue. And the issue is really going back to the University of Connecticut. You know, you have students together, they're young people, they're excited, they're back. How do you actually keep them getting in close quarters and not wearing masks? And that's ultimately where the real problem is, because one person with COVID can easily spread it to a group of people. And that's the idea behind surge testing. We'll do a lot of testing, go forth, make decisions, and continue it going forward. You know, we're dealing with a very difficult problem, new science, and of course, this is a public health problem that we have never had to deal with before.
Well, on the university campus, universities can control it pretty well, but it's off-campus housing sometimes where it's more difficult to control what students are doing.
How do you control off-campus behavior? The answer is you can't control it. You know, you can barely control it in the classroom, but you try to do it through education. You try to do it with public health. And the perfect example is smoking. Who would have thought there would be no smoking in Wisconsin bars and taverns in Wisconsin? I mean, I would have bet 10 to 1 odds that would never happen. And the answer is, once public health comes in and it becomes the usual thing that you're actually going to meet people with masks, that will make a difference. But for now, all we can do is try to educate those students and try to keep on testing them to see what's going to happen.
They're 19, 20, 21, 22 years old. That's not in their makeup.
It's tough.
Not in their makeup. That's exactly what you said. That's right.
When you do surge testing, do you get the results quickly or as quick as regular testing?
Well, it's really the new technology. So there's new technology where you can spit into a cup, then you put it into a machine. You get the results the same day. You get the results actually in 15 minutes. But of course, you need the machines, you need the cups, you need the people doing it. And in Germany, that's where they're doing it. They've ramped up testing. So no matter where you are, you can get tested and get the results very quickly. And once we have testing like that, we'll be able to get this pandemic under control. And until we have it, we won't. But the answer is yes, with good technology. And then there are some of the false positives and false negatives. But repeated testing really gives you the answer. Right now, we don't have quick testing. It's quicker than it was before. And we don't have enough testing. It's better than it was before. But we still have a significant way to go.
All right, 270-9933 is the number to call if you have a question for Zorba. We'll get to those calls in just a second. But first, happy belated birthday, Zorba.
Yeah, happy birthday, Zorba.
Thank you. I'm 37 spelled backwards.
270-9933. We'll get to your calls right after this.